some of the discussion. I wish could have been here for the entire session with the topic and what you were doing, thinking about these elements of bringing together government, understanding local challenges, and then creating almost what I've envisioned as a triangle that reinforces the patient at the center of the opportunity to provide sustainable care is so critical. I'm Chris Toth, CEO of Varian. Varian is a world leader in radiation oncology, looking at cancer care, cancer therapy in the context of women's health. We lead with radiation therapy for breast cancer, as well as looking at cervical cancer care and many other diseases that will interconnect, and obviously both men and women being affected by it. But those two that I referenced very specifically tie well into our picture of the company. In April of 2021, so this last year, Varian actually combined with Siemens Healthineers. We have a 70-year history as Varian concentrated into cancer therapy. And being very large in a global footprint, one of the elements we realized very quickly is having just a discussion about therapy without adequate infrastructure for diagnosis and being able to change the population to help figure out where disease is a gap. So we brought the two companies together to really represent this end-to-end ability to start with screening into diagnosis into therapy. Being here this week has been absolutely inspirational. I serve on the President's Advisory Council for Doing Business in Africa. This is my second term. If I were to compare and contrast how I feel about the conversations that are happening this week, I feel like we're really talking about a step forward from not only it being a discussion of communicable disease, but how do we build infrastructure for non-communicable disease as well? As we look at the population across the continent increasing and essentially doubling between now and 2050, building this infrastructure in a scalable, sustainable way, and taking the learnings of where mistakes are in many parts of the globe, where opportunities for improvement, efficiency, and quality of care are so important. And I co-chair the health subcommittee, and I lead the workforce development group. And the only item I wanted to maybe add into some of what I heard exchange is I also believe we have an amazing opportunity. You said this a little bit about the youth and really that movement as we think about the younger generation coming forward. We also have a chance if we create the infrastructure in the right way to be able to have sustainable jobs and careers that are very meaningful and impactful in the country. And to be here with my colleagues from Nigerian Sovereign Investment Agency and the work that's being done with the World Fund, that's exactly what we're seeking to try to accomplish together. In fact, the scope of what we are here to sign today is looking at a next step. We actually have already done a proof of concept where we have built the largest cancer center in the region by far. We have shown the capabilities, but what we've realized is we now need to think about the next level of scale. And Varian as a company, one item we have done is we've now not just looked at providing devices, but actually providing services and support for the clinical capabilities. And to digitize much of the clinical process so it can scale. And that's really what I would say drove our partnership to this next level of how do we think about multiple new centers? How do we think about partnership around training and education? And maybe not even just in the context of clinical care, but also for training for biomedical engineering. Those are very important jobs. So this is what we are seeking to do. And we know, back to the government funding point, there's always two sides to these discussions. And from the US government perspective, we're looking forward to leveraging the discussions we have and the relationships we have to try to help with that workforce development. And one of the exciting elements, of just maybe to note before we go into the signing here, and certainly want to give opportunity for any comments for my colleagues, is that two of the units as far as picture breakthrough. Cervical cancer is absolutely a challenge across the region. And brachytherapy represents a much more modular very direct way with high efficacy ability to treat that disease. So we felt that also created a very nice opportunity to announce it here. So please, if you'd like to add anything before we sign.